Hello, welcome, and thank you for joining Health and Wellness Opportunities for All. Questions throughout the entire webinar today can be entered via the Zoom chat feature. Please use this feature to enter any questions you might have about health and wellness with Northeast Delta Human Services Authority. Northeast Delta Human Services Authority is led by Dr. Montez A. Sizer, Executive Director. Collectively, we are all directed by our vision, mission, and tenets. Our vision: to build a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. Our mission: to serve as a catalyst for individuals with mental health, developmental disabilities, and addictive disorders. And our tenets that guide our actions: greater access to services, excellent customer service, and quality, competent care. Again, welcome to Health and Wellness Opportunities for All with Brittany C., Health Educator.
Thank you, Alan. I am Brittany C., the Health Educator here at Northeast Delta Human Services Authority, Prevention and Wellness Department. My role as Health Educator consists of providing wellness programs to our community, our staff, and serving the consumers in Morehouse and Ouachita parishes through our integrated healthcare program within our behavioral health clinics. Today, you will learn about our health and wellness programs and services that are being conducted for the people in our region. As we go through this presentation, please enter any questions or comments in the chat box, and they will be answered at the end. Let's go ahead and get started. Before we dive into the presentation, I thought it would be a great idea to begin with the breathing exercise. As we are nearing the end of a productive work week, I'm sure we all could take a few minutes to ourselves and just simply breathe. As we go through this activity, and I explain the benefits of why we are focusing on our breathing, I would like for you all to pay close attention to the pattern of your breathing and relax. The way we breathe affects our whole body, and breathing exercises are a good way to relax, reduce tension, and even relieve stress. Breathing exercises are very easy to learn, and you can do them whenever you want and without any type of tools or special equipment. The first exercise we will conduct today will be belly breathing. It is a simple technique and very relaxing. This form of belly breathing is basic and good to perform when you need to relax, relieve stress, or simply regain focus. First, I would like for you all to sit in a comfortable position and just go ahead and close your eyes. Place one hand on your belly, just below your ribs, and the other hand on your chest. Take a deep breath in through your nose and let your belly push your hand out. Your chest should not move. Then breathe out through pursed lips as if you're whistling, and feel the hand on your belly go in and use it to push all the air out. Now let's go ahead and try this technique again. Deep breath in through your nose and let your belly push your hand out. Remember, your chest should not move. Then breathe out through pursed lips as if you are whistling, and feel the hand on your belly go in and use it to push all the air out. Last rep. Deep breath in through your nose. Try hard to focus on your breathing. Clear your mind of clutter. Think positive thoughts. Now out through pursed lips. as your mind and body regain focus and relaxation. Notice how you feel after a few reps of belly breathing. Sometimes more is necessary depending on how you may be feeling, but I encourage you to do this breathing exercise as needed, at least 3 to 10 times, and really take your time with each breath. Now, let's discuss our health and wellness program efforts. What is health and wellness? Health and wellness are terms that are often interchanged, but their origins and meanings are different. According to the World Health Organization, the primary determinants of health include the social, economic, and physical environments and the person's individual characteristics and their behaviors. The maintenance and improvement of health, accordingly, depends not only on external or environmental factors, but also on the efforts and lifestyle choices of that person. According to the National Wellness Institute, wellness is considered an active process through which people can become aware of and make choices toward a more successful existence. This definition is based on three main components: being conscious, self directed, and evolving to achieve full potential at all times, being multidimensional and holistic, encompassing lifestyle, mental and spiritual well being, and the environment, and lastly, being positive and affirming at all times. The purpose of our health and wellness program is to work directly with the entire staff of Northeast Delta HSA, the community, and the consumers within our clinics to provide both direct education and health promotion in the areas of nutrition, health, and wellness in order to reduce the stigma of mental health, addiction, chronic illnesses, and encourage wellness as a way to break through those barriers. As a part of our commitment to helping our communities, putting our health and wellness first, along with bringing awareness to our integrated healthcare initiatives, are very essential to our organization when it comes to identifying changes in behavior. The Substance Abuse and Mental Health Services Administration, better known as SAMHSA, Wellness Initiative recognizes that the mind and body are interconnected and that behavioral health is inseparable from physical health. For example, a person living with a severe mental illness is twice as likely to have diabetes, to be obese, and even to smoke. Through our integrated healthcare program, we are able to combine primary care screenings and behavioral health care into one setting. By doing so, we are able to assess and treat consumers with serious mental illnesses and substance abuse disorders. We are also able to identify those who may have higher rates of chronic physical illnesses, as well as high rates of physical health concerns and conditions. You may ask yourself, why is integrated care important? Well, according to the Louisiana Department of Health, approximately 30% of adults with a chronic physical health condition also have one or more behavioral health conditions. And those can range from anxiety disorders, panic disorders, mood disorders, or even substance abuse disorders. Addressing the whole person and his or her physical and behavioral health is essential for positive health outcomes and cost effective care. Many people may have limited access to mental health providers, and they may choose to rely on their primary care provider for mental health treatment. The extent to which an individual may receive mental health treatment from their primary care provider will vary, but often depends on the person's diagnosis and their treatment needs. Historically, it has been difficult for a primary care provider to offer effective, high quality mental health care when working alone. So, by combining mental health services and expertise with primary care, can reduce costs, increase the quality of care, and ultimately save lives. Our health and wellness direct education component is a major tool that keeps our consumers engaged in their own health outcomes between appointments. They are educated through research, evidence based holistic practices to promote and support whole person health. We are able to provide these services through our Louisiana Pivot Grant Program. Pivot stands for Promoting Integration of Primary Behavioral Health Care. The overall goal of the Louisiana Pivot Program is to provide a coordinated, comprehensive approach to improving the overall wellness and status of adults with substance abuse, co-occurring mental illnesses, and physical health conditions and or chronic diseases. My role within this program is to conduct education and outreach in order to engage our clients and the community. The following components of my role in integrated care services consist of nutrition and exercise interventions, wellness consultations, health education, illness, stress, and self management programs. The following wellness programs that are utilized for direct education that are recommended by SAMHSA or the DART program. This program defines guidelines, encourages action, rewards continual improvement, and even transformation. We also have the WHAM program, and WHAM stands for Whole Health Action Management. WHAM promotes self management to create and sustain new health behavior and also incorporate chronic disease management. The In Shape Lifestyle Program. This program is very unique in which it helps people with serious mental illnesses and severe obesity lose weight. According to the Centers for Disease Control and Prevention, people diagnosed with serious mental illnesses are one of the most disadvantaged groups in the United States. And when you look at life expectancy, this is where the In Shape Lifestyle Program comes into play to incorporate those changes in behavior. And lastly, we utilize this new OR, which stands for Nutrition and Exercise for Wellness and Recovery. This program helps people with mental illnesses gain new knowledge and skills for healthier eating and physical activity. Consumers are able to examine their eating and exercise habits in order to identify what they most like to change about themselves and their habits and set achievable goals in order to make these changes occur. We also focus in on dietary plans, diet modifications, meal prepping, portion control, and making proper food selections. Now we'll take a look at our health promotion and awareness efforts. So, the purpose of our health promotion and awareness goals are to simply raise awareness about health topics to our staff, consumers, and community residents about the importance of preventative measures and their overall health. We deliver all information again through research evidence based practices to support our goals. Our efforts for raising awareness consist of resource setup with interactive educational activities geared toward the topic for the month and or that week, along with social media marketing. The upcoming topics for the 2021 fiscal year will consist of we're already in November, so National Diabetes Month. And the purpose of this month is to raise awareness about diabetes risk factors and encourage people to make healthy changes. According to CDC, people with diabetes are 20% more likely than those without diabetes to have anxiety or even become depressed. By promoting this month and incorporating ways to help cope with this disease, along with stress management, is our main focus. American Heart Month. The prevalence of depression in people with cardiovascular disease is threefold higher than that in the general population. The American Heart Association recommends that depression be recognized as a major risk factor for coronary heart disease, similar to hyperlipidemia, diabetes, hypertension, and smoking. There is about an 80% increase in the risk of developing a new or worsening cardiovascular disease, as well as death from cardiovascular diseases in adults with depression. So you can see how our Health awareness and promotion efforts go hand in hand with our behavioral health that we target on a month to month basis. National Nutrition Month. We will focus on the importance of making informed food choices and developing sound eating and physical activity habits. For next year, we will focus on foods that boost your mood. Stress Awareness Month. We will inform people about the dangers of stress, coping strategies, and harmful misconceptions about stress that are prevalent in our respective communities. And lastly, National Women's and Men's Health Week. We will use this week as a reminder to women and girls about the importance to care for themselves physically, mentally, spiritually, and emotionally. For our men, heighten the awareness of preventable health problems and encourage early detection and treatment of disease against men and boys. The consumers and staff of Northeast Delta, community partners, organizations, businesses, and community residents from our respective parishes will all be targeted in health promotion and awareness efforts. So now we'll take a look at community prevention and wellness efforts and what's to come. The Prevention and Wellness Department community health goals consist of fitness workshops and wellness fairs, awareness events, motivational contests, and future planning of lunch and learn seminars that will incorporate nutrition education, mindfulness, yoga, light aerobics, and light cardiovascular activities. One of our most popular events that was held on February 19th of this year was our jig aerobics. So the prevention and wellness team hosted a free open to all fitness workshop. It was titled Get Lit While You Get Fit through the founder LaDante Lotz. Jig aerobics is a dance-based fitness program that fuses jigging, which is an energetic Louisiana dance style, along with other moves and numerous plyometric exercises. So it's very, very high intense. This program focused on elevating one's body, educating the mind, and motivating the spirit. The prevention and wellness efforts saw a success rate of approximately 125 participants. So let's go ahead and take a quick look at the success of the Get Lit While You Get Fit Jig Aerobics dance program held at the Monroe Civic Center.
Oh, this was to get right alive in Louisiana. About to get lit while we get fit.
So, as you can see, the Jig Aerobics dance based fitness program is high intensity, cardio based. If you have the energy to do it and make it through, kudos to you. So, moving right along, during the week of August 1st through the 9th, our first annual Phoenix Fitness Week took place. That's a lot of words to fit into that. Phoenix Fitness Week. Due to the COVID-19 pandemic, we thought it would be a good time to connect with others and host this week virtually. Phoenix Fitness Week gave people a chance to focus on their well being and come together as a virtual community in order to share the importance of their health and wellness goals. Registration consisted of a Phoenix Fitness Week t shirt, water bottle, swag bag full of health and wellness resources, and a certificate of completion. For those with a competitive spirit, we took it up a notch and had them to not only register, but like our Facebook page as well. They also had to be active during the designated week and share a picture or video via social media in order to win even more incentives by virtually showing their physical dedication. Although this was a first for Northeast Delta, our registration and participation was phenomenal. Above is a promotional video we would like for you to take a look at of our successful week.
Hi there, everybody. I was running, now I'm biking with Northeast Delta Human Services Authority because they know that no matter what COVID-19 may have done to us all, being active still is important. But being active just isn't for physical wellness, remember, it helps mentally too. Meaning a run, walk, bike ride like right now, or any activity really, helps me mentally and physically, creating healthy individuals and healthy communities. It's great for us all. So make sure to physically distance, but no matter who you are, age, sex, race, physical ability, currently active or not, whatever, come join us. Register, pick up your gear, be active safely, and share. Make yourself and your community better.
There is so much more to working out than losing pounds and inches. Staying active can help improve sleep quality, improve memory, improve decision making, reduce anxiety, stress, and depression. I think we can all agree that we could use that during these very confusing times. At Misfit One, we create a sense of family, community, and accountability. It's our way of staying together while respecting social distancing. By staying active, it is our hope that we are all not only physically stronger when we beat COVID-19, but mentally and emotionally as well. So let's get moving.
Hi there, Coach DJ Davis here, and I'm getting ready for my run with the Northeast Delta Human Services Authority because they know no matter what COVID-19 may have done to us, being active is still important. But being active isn't just for physical health. It helps you mentally too, meaning a run, a walk, bike ride, or even bodyweight squats. Really helps me physically and mentally, creating healthy individuals and healthy communities. So no matter what you are, age, sex, race, physical ability, currently active or not, whatever, join us, register, make yourself and your community better. Come on, let's get it. That's it. Move. Ah, yeah. Again. All right.
According to our final results, we had 302 people registered to participate, over 50 social media posts shared from our participants, and over 20 different types of fitness activities engaged in by people in our region. The activities range from walking, running, biking, strength training exercises, and even gardening. We presented two participants with prize packs to show our appreciation because they went over and beyond to show their dedication and motivate their communities about the importance of putting their health and wellness goals first. In the middle picture, what you see as their incentives consist of a yoga mat and bag with our created logo that states transforming the mind, body, and spirit, a Northeast Delta logo towel, wristlet, earbuds, pedometer, waist pouch, blanket, and our newest incentive, Health and Wellness Food and Fitness Tracking Journal, which was created by the Prevention and Wellness team. If anyone is interested in learning more about the journal, please feel free to email or call me. Now that we've covered our community efforts, I think it's time to incorporate another activity to jumpstart our own goals. So, since we have all been sitting for a while now, I would like for you all to stand up, stretch a few times, and get ready for a brief physical activity workout to just simply show our hearts some love. So, let's go ahead and take a let's move break and get ready to walk.
Hey, you want an instant energy boost? You feel a little sluggish? You know, lack of energy comes from stress, lack of sleep, poor nutrition. But the biggest energy drainer is lack of activity. So come on, let's do something about that right now. Come on, walk with me. In just 5 minutes, you are going to feel focused, alert, full of energy. Come on, I'll prove it to you. Just walk in place. Nice, nice, nice. Come on, pick up your feet and go. Walk, walk, walk. Please have walking shoes on. If you're at the office, sorry ladies, no heels. You gotta have walking shoes on. Just walk, walk, walk. Good. You know, some people think that exercise makes them tired. No, exercise brings energy. Try a side step. All you do is step out to the side, bring the other foot in to meet it. Little easy side steps, but it's brisk. Exercise brings energy because it gets the heart pumping. You get oxygen to the working muscles. Whew. You get a big boost. Sitting makes you tired. The more you sit, the more you want to sit. The more you move, the more you want to move. It's instant, natural energy. You're doing it now. 4, 3, 2. Walk, 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 walk. Some other ways to keep your energy up. You got to stay hydrated, guys. Drink that water. Come on, just walk. 2, 3. Now, how about some kicks right here and kick, kick. Also, how about breakfast? Did you have breakfast today? That's a way to keep energy up. People that skip breakfast, you're tired all the time. How about your sleep? You getting good sleep at night? 7, 8 hours of sleep, you need it. Okay, that keeps your energy up. And take a multivitamin. Those are all ways to keep your energy up. But by far, the #1 way to keep energy going, natural, good energy, not jittery energy, natural energy. It's this, you're doing it. Come on, walk. Walk strong. Go. Knee lifts are coming. All right, try a knee lift. All you do is lift the knee and lift the knee real high. Put the thigh muscles in motion, the back end, and get your posture ready, okay? Take your tummy, belly button toward the spine, flatten it up. And then bring your shoulder right above your hip bone and you've aligned your back. Now you're walking tall, you have great posture. 2 easy moves, flatten the tummy, put the shoulder above the hip bone. You did it. Come on, knees. 4, 3, 2. Walk, 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 walk. Let's move around, 2 up and 2 back. All you do is move forward and move back. If you don't have a lot of room, don't worry. Just stay there and walk. But if you've got room, let's go. Come on, stretch your legs out, move your muscles. Walk, 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 walk. Backing up, good for your balance. Good for the muscles behind you. You know those are all undertrained. The muscles in the back of our body need extra training. They're just going along for the ride. A backup motion helps to light those muscles up. Good. 2 more. We're going up and back 2 more times. 1 more time. That's the way to walk. That's the way to walk to get energy. Upper body, reach forward and pull back. Reach forward. Can you feel your core temperature is up? Your body temperature already in just a few minutes goes up. That's it. You're bringing warmth to the muscles, fluid into the joints. 1 more to the front now. Go up over the head. Reach high. Come on, reach really high and stretch it out all the way through the fingers. Reach. 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 4 more. 4, 3, 2. Good for you. Power walk, pick up feet. Side steps are coming back. 4, almost done. Here it is. Just step out to the side. Dig in a little. That is sit down into it. Bend your knees and step out. Step out. Out together, out together, out together. 8 more. 8, 7, 6, 5, 4, 3, 2. You're walking now. Go walk. Very nice. 4 more. 4, 3, 2. We're kicking now. Just kick. 2, 3. Lift your knees for 4. 4, 3, 2. Go back to kicks for 4. 1, 2, 3. Knees up for 4. Last set. And last set of kicks for 1, 2, 3. Let's walk again. Walk. That was it. That's your 5-minute, 500-step energy booster. See you next time.
Now that we've recovered from our work break, remember, it is important to move more and at your own rate. A good starting goal is at least 150 minutes a week, but if you don't want to sweat the numbers too much, just simply move more. Find different forms of exercise that you like and that you'll stick with, and build more opportunities to be active into your routine most days of the week. Now, taking a look at wellness at work with Northeast Delta HSA. The purpose of workplace wellness is to equip our employees with healthy lifestyle information that can be utilized in the workplace and carried over into their home life with family and friends in order to help everyone be the best that they can be. The goal for workplace wellness is to also encourage our employees to take their physical, mental, and emotional health to the next level and help them achieve their health and wellness goals. In order to make sure our team was building a solid foundation geared toward workplace wellness, we conducted an employee wellness interest survey that was completely voluntary. The results of the survey were analyzed through our behavioral and primary health analytics team, and it helped us to be able to develop a future as to what our programming will look like and make sure that it was in line with our employees' specific health and wellness goals. So we asked a total of 10 questions, and those questions ranged from background information, would they participate, and if so, what day, time, how often, how would they like to learn about health and wellness, did they have access to internet outside of work, what kind of topics were of interest to them, and even what kind of incentives would they like in order to increase participation. As you take a look at the statistics above, I will explain in detail the data summary based on the answers provided from the participants. So we had a total of 69 employee wellness interest surveys that were completed last year in December. 50% of the employee respondents were between the ages of 25 and 54 years of age. Out of that percentage, 65% were female and 35 were male. Over 95% of employee respondents stated that they would participate in health and wellness programs and even our activities as long as they were of interest to them. Wednesday was the preferred day of week for wellness activity participation, followed by Mondays and Thursdays. More employees indicated a preference for activities to take place after work than any other time of the day, while the least preferred of the time of day, was the morning. The majority of employees felt that wellness activities should last around 30 minutes. Over 66% of employee respondents indicated that they have already made some health behavior changes, but are having trouble following through. And over 25% said they are thinking about or planning to make change of some sort to increase their current health behaviors. Wellness goals identified by employees included exercising more regularly, weight loss, and healthy eating. Attending on-site wellness workshops was the most popular choice for learning about health and wellness, followed by group support and events and even online programs. When asked what would incentivize them to participate in wellness activities, nearly 45% of employees stated that no incentive would be necessary, but the other half indicated that gym memberships as well as exercise equipment would be a good incentive. Based on the data summary, we gathered the most popular responses and created a calendar of events to start our wellness at work efforts. Throughout the year, our employees receive an email blog geared toward health topics of interest, and the blog consists of information about the topic presented, SMART goals to help them outside of the workplace, tips, and recipes. We are currently planning our fiscal year 2021 Wellness at Work objectives, and some topics will include meditation and relaxation, foods that boost your mood, health and wellness phone and tablet applications, and small changes that equal big results. Motivational challenges for employees will consist of food journaling, fitness tracking, and water consumption challenges. All challenges will result in incentivizing employees based on their participation. Along with our Wellness at Work initiatives, we have developed a wellness room for all employees that will be available for use 2021. The Wellness Room plan was designed to help employees focus on their health or simply recharge for the day. Having the ability to unwind in a private, quiet area is a great way to increase work productivity, performance, and overall job satisfaction by having the space to alleviate stress, meditate, and even do light yoga exercises. Our most popular asset to the wellness room are our massage chairs that will be utilized for massage therapy. The purpose of massage therapy is to help manage health conditions or enhance wellness. According to the American Massage Association, this form of therapy has been found effective in the world by reducing negative stressors such as aches and pains, anxiety, and depression that people may encounter on a day to day basis. Therapy can be provided in various forms, such as with a massage therapist, chiropractor, and even a massage chair. So, what are the health benefits of massage therapy? Massage therapy can reduce stress and anxiety while increasing productivity and alertness, ease symptoms of depression, improve your mood, boost mental and health wellness, improve cardiovascular health, reduce blood pressure and increase blood circulation, generate more flexibility, relieve muscle tension, pain, and headaches, manage lower back pain, spark creativity, boost immunity, and our favorite, provide relaxation. Most Americans are incorporating massage therapy into their regular health and wellness regimens to assist with medical conditions. So let's take a look at what's being reported. 88% of individuals view massage as being beneficial to overall health and wellness. 88% of individuals believe that massage can be effective in reducing pain and has seen some major changes. 75% of consumers surveyed claimed that their primary reason for receiving a massage was either medical or stress related. And 53% of people say that their doctor has recommended that they do indeed get a massage for health purposes. In addition to providing massage therapy for our employees, we will also have a chair available that will be utilized by our consumers who are enrolled in our Pivot Integrated Healthcare Grant Program. Moving along into more of workplace wellness goals. Well Ahead Louisiana is an initiative started by the Louisiana Department of Health aimed at improving the health and wellness of Louisiana residents. Well Ahead Louisiana promotes and recognizes healthy choices in the spaces and places where we live and work every day to make life easier for us all to live healthier, happier lives. Well spots are a key component of the Well Ahead Louisiana initiative. Well spots are recognized in places and organizations in Louisiana who voluntarily implement healthy changes in their environment to help their employees and communities live well. There are well spots throughout the state who are putting the health and wellness of Louisiana residents first. Well spots show employees, students, patients, patrons, and more that they can live well by making small choices. Healthier employees, as we know, are happier, they miss less work, they are more productive, and their healthcare costs even go down. Healthier students are better learners, and healthier hospital and healthcare facility environments can improve patient outcomes. According to America's 2019 health rankings, Louisiana is 49th in overall health. We were 50th in 2018, 46th in physical activity. We were 44th in 2018, 44th in cancer deaths, the same as 2018, 47th in diabetes, same as 2018, 43rd in smoking. In 2018, we were 48th, and 47th in obesity, the same as 2018. So, based on those statistics, we have some major improvements, but we must continue to work hard as a well ahead community to continue to shape the lives of our Louisianians. According to the WellSpot designation benchmarks, organizations that meet certain benchmarks can be designated as a level 1, 2, or 3 WellSpot, with level 1 being the highest. Our organization type falls under the work site category, and we are currently designated as level 2. Level 2 indicates that we have a tobacco free policy and 5 benchmarks of choice have been met. The table above shows the benchmarks in detail and what is needed to fulfill having completed all tasks. Well Ahead Louisiana spotlights well spots each month on social media, and our prevention and wellness team was contacted in order to highlight the new designation of our prevention and wellness office, which is located at 2406 Ferran Street in Suites 18 through 20. Up above is a photo of our prevention and wellness team, minus a few, and we were elated to be a Well Spot highlight for the Well Ahead Louisiana initiatives. As you can see, our organization works hard to uphold the mission of being a Well Spot through Well Ahead Louisiana, providing our employees with ways to implement wellness to create healthier lives is an ongoing commitment of ours. Our ultimate goal is to encourage, motivate, and support the enhancement of wellness through education and providing resources to take wellness goals to a higher level. Now let's take a quick look at Northeast Delta Human Services Authority employees and their wellness at work participation and efforts, which shows dancing, mindfulness, Phoenix Fitness Week, and Go Red for American Heart Month. As we conclude, recognizing that the wellness approach is a whole person, strength-based approach is very important to us here at Northeast Delta. We recognize that wellness is a multi-layered dimensional of dimensions of wellness, as we can see above with the 8 dimensions of wellness. Wellness is personally defined, meaning that how we address our needs in each dimension depends on our goals, our beliefs, our values, culture, personality, preferences, and even life experiences. Wellness actively involves the consumer in decision making by using collaborative efforts and recognizing and building on the consumer and community strengths. Lastly, wellness aims to increase overall quality of life, healthy habits, and gaining personal control. Northeast Delta HSA directs and manages the operation of community based programs to improve the quality of life of people with major mental illnesses, addictive disorders, and developmental disabilities. Our 12 parish area in Northeast Louisiana are Caldwell, East Carroll, Franklin, Jackson, Lincoln, Madison, Tensall, Morehouse, Washita, Richland, Union, and West Carroll. We are devoted to delivering programs and services that encourage people to reach their true human potential. Northeast Delta HSA operates 6 mental health and substance abuse clinics throughout the 12 parish service area. The Monroe and Bastrop clinics are piloting our integrated care program in addition to providing mental health and substance abuse treatment. All of our clinics provide services to individuals regardless of their ability to pay. We are the state's safety net for mental health, substance abuse, and developmental disability, and have access to treatment. Northeast Delta operates a 24/7 crisis hotline for mental health and addictive disorders. There is someone answering the call of those in need, regardless of the hour, and they are able to provide appropriate interventions and make the necessary referrals for treatment. And we also have a crisis helpline for our developmental disabilities area as well. Northeast Delta HSA Prevention and Wellness Services, or information dissemination and opioid prevention, safe medication and disposal, underage drinking and bullying, community education, NORCAN education, and Generation RX, alternative activities for youth, which consists of student ambassadors, youth summits, and student retreats, school-based interventions through evidence-based programs such as positive action, which helps students identify themselves and understand their self-concept, life skills, which teaches students the necessary skills to resist peer pressure to smoke, drink, or use drugs, Project Toward No Tobacco, TNT, which teaches how to resist using tobacco products. Kids Don't Gamble teaches how to clearly define gambling and the types of gambling. Al's Pals, kids making healthy choices, and they can develop social emotional skills in children 3 to 8 years of age. And Buddy Benches, which reinforces kindness and belongingness. Trauma Informed Care, Adverse Childhood Experiences, ACEs, which provides training and preventative measures to create safe, stable environments while helping children build social emotional skills and resilience, and building alcohol and drug free communities through coalitions. There are 3 coalitions in Northeast Louisiana. We have 2 in Washita and 1 in Franklin Parish. The goal of the coalitions is to recognize that alcohol, tobacco, and other drug abuse is a serious social and public health issue that, when addressed, will create a climate of healthiness and community wellness for all of Louisiana. Northeast Delta is committed to reducing social determinants of health through our special initiatives. Behavioral health and primary care integration is a progressive approach to reaching the best outcomes and caring for people with multiple healthcare needs. Opportunity Zone is a strategic initiative designed to help transform communities by increasing access to services and promote healthy community behaviors. Coordinated care for people in crisis aims to catalyze and improve care for people who suffer from mental health issues and addictive disorders by engaging law enforcement leadership and hospital systems to address the need for increased psychiatric inpatient hospital care and improve protocols for people in crisis who come in contact with police or enter emergency rooms. faith-based outreach engages faith-based communities in our efforts because of the contributions we know that they can make to help stabilize traditional mental health services. By our faith-based outreach, our clergy leaders, they help us understand as well as their own congregation to acknowledge what those challenges are and how we can conquer those challenges. And Operation Golden Years provides increased awareness, support, and services for those 60 and above. And our vision is to enable often overlooked seniors to not just survive, but rather thrive through the golden years of their lives. Thank you all for joining our webinar today on health and wellness initiatives through Northeast Delta HSA. If you have any additional questions or would like to discuss how prevention and wellness can further assist you, please feel free to contact me at brittany.c, that's BRITTNEY .SEAY at la.gov, or I can be reached by phone at 318-283-0868, extension 1407.
Thank you so much, Brittany. We will now take questions via the Zoom chat feature. And those, we already have some coming in today. And if we are unable to address your question today, we will follow up via email as soon as possible. There have been some questions submitted privately to me, Brittany. And what I'd love to do is ask that first question is, what impact have you seen take place with the consumers and even employees that you serve through the integrated healthcare program and workplace wellness here at Northeast Delta Human Services Authority?
So, being able to conduct wellness consultations, educations, and even provide many resources has honestly had a positive impact in the overall well-being of our consumers. A lot of our consumers view our wellness component as a way to increase their knowledge, gain more knowledge about their overall health and wellness well-being. And also they like to take the information that they learn and also encourage their family and friends as well, so that they can all live better lives. And also, once they leave our clinic, they still have access to me for any information at any time that I'm available. I also conduct follow-up calls, so it's not like they just come in, and have a face-to-face or have an interaction with me here and there. We do follow-up calls and make sure that they stay on track. So that's definitely has been a huge positive impact within our integrated healthcare initiatives here. As far as I think you said workplace wellness, as far as that component, I do receive quite a bit of individual contact, whether it's asking for a recipe, stress management type things, a lot of personal goals, or just research dealing with, what can we do to improve different things throughout, our lives. And so since I get to see a lot of my coworkers, face to face or what have you, they know I'm always going to ask, like, how are your actions going? Are you putting actions behind your goals? Do you need anything else? Don't hesitate to contact me. So accountability and check-ins is very, very important. So in all, we do offer a lot of our standard components when it comes to workplace wellness, but I think the individuality of it all as well plays a huge role on making all of this very, very successful. And overall, I know the impact comes from basically consistently encouraging and motivating and supporting everyone and just simply being there and knowing that they know that I'm available, whenever.
Great. Thank you so much, Brittany. We did have one question that was submitted during the webinar today from Julia Albritton, and I will read it verbatim. Quote, "Hi, Brittany. What are some of your recommendations to ensure we get the maximum amount of sleep each night, especially for those of us that suffer with insomnia and are groggy for most of the day?"
That's a great question, Julia. So, and I suffer with this myself. I've gotten a lot better. So, um, not just on my personal experience, but research-based information as well. Making sure that you go to sleep at the same time each night. I know that may be far-fetched, but trying to get on a time schedule is very, very important. Try not to take naps after, say, 3 or 4 o'clock. Of course, the later you take a nap, then you may be up. If you do, sometimes you just need to, relax for the day. Try not to take a nap more than maybe say 15, 20 minutes. That way, you're not taking a nap late and then still trying to stay on your time schedule. So get your body adjusted so that you can get used to, doing the same thing on a routine basis if possible. That'll be my first advice. So going to bed around the same time every night and making sure that you wake up around the same time. That way you'll get on, a consistent schedule. Also, if you drink a lot of coffee or caffeinated beverages, try not to have them too late in the day because that will, offset you quite a bit. And also, being consistent with exercising is very, very important. A lot of people, of course, it gives you energy, but if you do it, say for instance, you get off work at 4:30. Well, if you go ahead and exercise when you get home, that way, as you kind of dwindle down and get prepared for bed, say around 10:30, your body has had that boost of energy, such as the walk that we had. You got your boost of energy, and now it's time to settle down. So even though you may not be feeling sleepy, but when it's time to relax, your body is not necessarily drained, but it's more in a relaxed state so that you'll be able to sleep throughout the night. I hope that answered a little bit.
I'm sure it did, Brittany, and thank you for that. And one final question with the short time we have left that was submitted before is, what does, for anyone listening, need to do if they have any further questions or interest in your program area or any of the Northeast Delta Human Services Authority services that are offered that they've heard about during the presentation today?
Okay, if there are any further questions or interest in my program area or Northeast Delta Services, again, you can email me at brittany.c@la.gov or give me a call at 283-0868, extension 1407, and we can discuss the request further. Or if it's something not directly, geared toward me, I'll make sure that I provide assistance to get you to that direct person. And also, for any upcoming events or community efforts that we may have, we can be followed via Facebook at Northeast Delta, I'm sorry, NE Delta HSA for any upcoming events. You can also email me your contact information and we can add you to our own prevention and wellness contact database as well. So that way, anything that we email out, you'll be, first to get it. We also have an internet page inside nedhsa.org where you can keep up with any agency events, read all of the latest news, any health news, and also any social media updates as well.
Thank you so much, Brittany. That is great information for all of us. And for everyone out there, thank you for joining us today. As she noted, please visit us on our website at www.nedeltahsa.org. And you can follow us on any of those social media channels via our handle at NEDeltaHSA. And Northeast Delta Human Services Authority is building a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. Thank you so much, everyone.